Another question as part of the piloting: did families reach the milestones we expected on the way to achieving longer-term outcomes? And in this one, families experienced small saving increases. About a third of the families opened child savings accounts, and surveys showed increases in financial capability. And finally, and really importantly, have lessons been learned that will inform the full-scale implementation? So finally, the pilot produced a set of lessons to inform implementation. The original theory of change was slightly modified to incorporate these lessons. And with that, I am going to turn it over to Jeannie.
Thanks, Susan. So those of you that heard Roxy barking a minute, she wanted to make sure everybody on the webinar knew that the UPS driver had made a delivery. So sorry about that. Okay, so Susan mentioned that, you know, you really need to have a theory of change so that you can be clear about what it is you're piloting. And so if we were to do an audience poll right now and ask you how many of you are familiar with theory of change, I bet we'd get nearly 90% of the folks on the call to say, yes, I am familiar with theory of change, because that's something that we have done a lot of work on across the Community Action Network, right? We have a national theory of change that drove the revision of Roma, and many of you I've seen have been creating your own agency theories of change, and you may have theory of changes for your whole family approach, or for other initiatives, projects, or approaches that you're operating. And that's important because that theory of change kind of is your it lays out your assumptions, and it's your hypothesis about what you're really trying to do. But just as a refresher here, I'm going to talk for just a minute about theory of change, because it's really important to piloting. So first off, you know, in its most simplest terms, you could say that theory of change is really a statement that if we do X, Y change will occur for families and communities. And so the example here we have for you today is if we bundle services and the supports for adults related to workforce, financial management, and work supports over a 3-year period, then the adult participants will be more likely to achieve economic stability and success. And of course, our full-blown detailed theory of change would talk about what we're measuring and how we might document that. So it's a if we do X, Y, change will occur. So if we bundle services, then families will be more economically stable and successful. And I wanted to give you, you know, that's sort of at its most basic, the sort of basic idea. And then when you build out your full theory of change, you have more detail. So here is the theory of change, a whole family theory of change for People Incorporated that is located in Abingdon, Virginia. That's the southwest corner of Virginia, and they also serve some northern counties here in Virginia. And they developed this theory of change for their whole family approach. And you can kind of see over here on the left that they talk about different services they're going to provide for adults and children. And they're really saying that if they provide coordinated, bundled services and coaching for families, the families will be stabilized, they'll build assets, and the change will be that there'll be increased resiliency for the children and more self-sufficiency for the families and the parents overall. So they've got their if and then here in their statement. And then down below, they've got their underlying assumptions, which is also a part of your full theory of change, So what are the assumptions that they're making about what will happen and what will be the situation with their families and their customers? So here's a full theory of change, and you can kind of look at that more closely when we post the slide deck. And then the next slide sort of gives you a template, if you are new to the theory of change discussion, about the elements. So again, it's that if and then statement, but it's also what are our assumptions. A theory of change really helps you think through the change and the impact that you're trying to achieve. So that's your outcome. What problem are you addressing? So, being very clear about the problem and where you're trying to go and the outcomes is essential before you dig in and maybe do any piloting. And having this whole theory of change, all of these aspects laid out, helps you really see maybe what you need to do in a pilot and what your pilot might look like. So one other thing that I wanted to mention, and I'm just trying to provide some of the community action content here, is that many of you may have a theory of change, but you may also have logic models. And your logic model is the way you really operationalize your theory of change, right? So you have some of those broad things laid out about the problem and your outcomes. And in a theory of change, you're really operationalizing what are the very specific services and activities that we're going to provide, what are the short, intermediate, and long-term outcomes that we're going to get at, and what tools will we use to measure, what will be our data sources. So you may have a logic model also that will help you. Ideally, you would have your theory of change laid out and your logic model, and then you would be using those to help you inform what your pilot might look like, for this effort before you go to a full scale. So I'm going to pass the ball back over to Susan to talk to us a little bit more about how you would take a pilot, how you would take a theory of change in your logic model and then think about using a pilot and going to scale. So Susan, passing it back to you now.
Okay, thank you. If you think about a theory of change as being about the what, then a theory of scale is about how you take that what and grow it to a size that will make a difference, whether it be a difference in your agency, in your community, in the country, in the world. For today, in this particular webinar, we'll narrow the discussion to kind of your individual agencies and the communities. And this slide lists key components of a theory of scale. So you have to be really clear about what are the resources and assets that we have, what are the ones that we will need to grow this. What would the sequencing and trajectory and length of time be for kind of scaling this up? Really critical when you think about scale are your stakeholders. Who's going to scale it up? Who's going to support it? And then finally, what's your definition of scale? And in pilots, we often talk about we're going to serve, 300 people or 100 people or 200 people. When you are developing a theory of scale, you really start using percentages more. You think, well, if my agency serves 1,000 people and I'm trying to do this new thing that I think is so much better and is going to benefit them so much more, well, then maybe I want to reach 90% of the people that our agency serves. So again, just the difference here between a number that helps you frame a pilot and a percentage which helps you kind of frame what's the percentage of people I need to reach in order for change to really start to occur. The following is an example of a theory of scale within one agency. And you can see how it incorporates the components described in the last slide. It would include a little more detail than on this, that's written on this slide, but these are the basics. And, remember, based upon what Jeannie was saying, your theory of change is embedded within your theory of scale. So, so sort of listen to the component parts of this relatively short frame. So we can achieve scale in 7 years by first piloting, right, we already have your theory of change, a whole family approach with 100 families over 3 years. So first part of my theory of scale recognizes the pilot. To achieve scale, we're going to need buy-in from staff at all levels, including 5 key program areas. So in that this is a whole family approach, it might be your Head Start, it might be your after-school programming, it might be your workforce and financial capability program. So programmatically, those are key people and departments. But also for scale, you have to start thinking about your finance department. How are you blending funding streams? You need to think about your IT department. So how is the data being collected easily across the various departments? So key stakeholders. Also as part of our theory, and this could be related to theory of change and theory of scale, that building this out will require including staff and families in the design itself. But we're not going to go from a pilot to full implementation without staff and families as major stakeholders and designers. And then moving towards the last part of the theory of scale, by the end of year 7, 3,500 families will have access to a whole family approach. And again, moving to a percentage, what this means for this particular agency is that 70% of all of our agency's clients are going to be served by this approach. And you might say, well, why not 100%? Well, right, very few things ever reach 100% in this business, but it's also not every single service that the agency does is family focused. They're, part of the mission of this particular agency might be to serve seniors. There may be some transactional type services, emergency type services that are still needed. So, but if you're reaching 70% of your clients with this type of service, you've really changed your organization, and you're really serving people differently across the organization. And so in this case, we would say 70% would be the definition of scale. Okay, so the next example is actually pretty similar. It's also about the full family approach, but now it's saying, well, what would scale look like? What would my theory of scale look like if I wanted this to not just be an internal effort, but to really be a community-wide effort? And I think, a lot of you know that, and that's already the kinds of work that you're doing. It's probably very seldom that it stays within your agency completely. So in looking at this, so it builds off of what you saw on the page before. So we can achieve scale by first investing in our internal resources, but now while simultaneously reaching out to key external groups to create a regional whole family approach. And so in this case, the external groups might be, Department of Health. It might be transportation. It really sort of depends on how you're viewing it, but it requires a different level of buy-in, and you're sort of cultivating both the agencies and leaders within those organizations. So the next part of the theory is within 3 years, So this is the staging. Within 3 years, we believe a strong collaborative will be in place with community buy-in, coordinated funding streams, and using continuous improvement. This effort will grow in scale so that within 7 years, most services provided by the collaborative provider members, so let's say there are 4 that have become key to this, so that most services are using the whole family approach. And the number we've made up here is so that 15,000 families will be reached annually, or again, critically important, about 70% of all clients served by these particular agencies are going to be served with the whole family approach. So we're now going to move to a poll. And the question here is, building off this discussion around scale, do I feel pressured from funders to scale up fast? True or false? Because as you notice, I was talking about 7 years when I talked about scale. I've worked on projects where it was more like 10 years, in fact, before we had reached a significant level of scale. So what's your answer? I feel pressure from funders to scale up fast. True or false?
And we have answers coming in. And folks, as you're answering this poll, don't forget when you hit true or false, you have to hit submit. Also, we're going to take a break for some questions here in a second. And obviously, since you're muted, you're going to need to send those in through the chat window. Please be sure to select all presenters and panelists, although I will be moderating questions for Jeannie and Susan. All right, it looks like the results are coming in. We'll give it another minute or so, but it looks like they're coming in roughly tied. So far, a little over half the respondents are saying true. They are feeling some pressure from funders. A little more than half are saying false. They're not feeling that pressure. So there's definitely a mix of experience on the line. I'm going to go ahead and give everybody about 20 more seconds to do that, and we will move on into questions. So please do be entering those in the chat window.
So Susan, this is Jeannie, and while folks are wrapping up their answer, I just wondered if you could talk for a minute as somebody who's been in philanthropy and at a foundation. If you had a grantee who really actually had this theory of scale and they were clear about where they were going and what they were trying to achieve, if you treated that grantee in a different way, maybe didn't put as much pressure on them because you knew they thought out kind of how long their pilot was going to be. One of the things I see is that people talk about having a pilot and they don't really have a theory of scale. They don't really know how long they're going to pilot and what is the end of the pilot. So just a minute,
Sure.
While we're waiting for questions and answers, if you could talk a little bit about that.
Sure. I mean, it's a really good question. What's the purpose of the pilot? Right? As we talked about sort of the stages here, and from a funder perspective, the funder needs to know what the purpose of the pilot, and the grantee needs to understand what the purpose of the pilot is. And then does the foundation, for instance, have a theory of scale? Is the pilot on its way to something larger, to something scalable? Or is it always the idea that both the grantee and the funder are going to just kind of extract lessons from this pilot, and then it will become something else? And I think where there's challenges sometimes, and this is when there's not when there's a lack of clarity about what that purpose is, or if the funder has one idea and the grantee might have another, and then an awkward place that I would guess all of us have been in from one side or the other is, and then the pilot ends. and it just ends, right? And, you know, sometimes a foundation might have said, well, you should raise other funds to continue it. But, you know, 2 or 3 years actually isn't a really long time to demonstrate a lot of results, so that might be challenging. So I'm not sure if I completely answered your question or just raised some other questions as well. Did I get at what you were kind of pondering on?
Yeah, I think you know, having clarity, and I think what we're sort of suggesting here is that if you have both your theory of scale and your theory of change, and you're testing things out and you're clear about where you're going, you know, you're going to be in a much better position. So I think so.
Right. Yeah, because there are risks to an organization sometimes in a pilot, and if there's not a plan for how it will unfold over time.
Mm-hmm. And really, I think that's sort of the kernel here of some of what got us into talking about prototyping and piloting as a network was we were seeing folks, as I said earlier, running pilots, and sort of the pilot was just, you know, going and sort of like, well, where are we going? What's our purpose? So I'm going to be quiet for a minute. Have we gotten any questions?
We've gotten a couple, and let me sort of boil these into a couple of questions for you. First, how do some agencies that are doing this convince funders to get on board with sort of braiding these services for families, i.e. a funder, the specific was, how do you convince Head Start that you're going to serve a lot more families than just your Head Start families, but yet you're obeying the rules of their funding?
I'm wondering, Jeannie, if that is more about using how you might use federal funding and sort of where there are different kinds of restrictions.
Mm-hmm. I think that's exactly what
is that right? Okay.
Mm-hmm.
Yeah.
And just some thoughts on that would be welcomed. I think you're going to address some of it along the way.
Right. I guess my first reaction would be that, you know, having your theory of scale and your theory of change, and being able to show that to a federal funder. I always thought, you know, when I was at OCS, when somebody brought something to us that was clearly thought out and it was very clear where they were going, and if they had even tested it a little bit, like you might with a pilot, and they had, you know, some learnings that, you know, was hard for us not to support that when people, you know, could demonstrate there was, you know, promise and good potential there. So, you know, this is sort of where I come back again to sort of, you know, if you've done your homework and thought all this out and tested it, you know, through a pilot and maybe even done some prototyping and made some changes in the beginning, and you can explain all that to a federal funder, you know, in my experience, it's pretty hard for them to push back very hard on, and they will tend to more, you know, want to support you, because anybody who's can demonstrate that level of commitment and effort, you know, you want to be in a position to support them, because that's going to potentially be successful. So I guess that's sort of my first thought about it.
Mm-hmm. Jeannie, does it sometimes require waivers, or is that a more formal process?
I think that is a formal process, and you know, some federal funding streams, you know, allow that. You know, in CSBG, it's not really a waiver, and I don't think there is in Head Start either. But it's more about you know, making sure that there's no concern from the federal office that you're, you know, using Head Start funds or CSBG funds improperly. And so, of course, you got to follow the rules. Of course, I think there is some level where maybe people may want to get into the waivers, and that may be more in the TANF and, you know, some other spaces that people are working in. If you're asking, you know, if you're going to go and ask for a waiver, you definitely have to have this kind of thing thought out.
Mm-hmm. All right, great. Thank you. I think that wraps the questions for this part of it.
Okay.
Okay.
Hand it back to you, Susan.
So now we're going to move into another related topic, which is continuous quality improvement. The slide you're looking at now is, I guess now the infamous 737 MAX airplane, the Boeing. And, you know, and you sort of reflect, this is sort of an example of continuous improvement and how important getting it right can be in certain fields. But it's also, you know, when you think about, they had probably a pretty good 737. You know, I know I've flown on the Southwest version of that a lot, but then they were trying to address some challenge problem and they improved upon it, but the improvement actually introduced, you know, this sort of deadly technology issue. And so now they're into the next wave of continuous improvement. I mean, thankfully, most of the things that we're working on don't lead to this kind of tragedy, but the principle of having an idea, trying it out, figuring out if there's something that you want to improve, and having this be kind of this iterative type of process. And look at this, we're back to another poll. So we would assume so I'm assuming that you've done some continuous improvement, whether you've named it that or not, but you've looked at places where you've had challenges in the programs that you're delivering, and you've made some changes. So which of these continuous improvement approaches may you have used? There's Six Sigma, there's Fail Fast, Fail Forward, the Plan, Do, Study, Act, or it might be that you haven't used any formal approach or methodology. But if you could address this poll.
All right, folks, again, your chat, it's in the same place where you would see your chat window, and it should come up under poll questions with 4 choices, and you actually have the opportunity to select more than one if you've done that. So please do go ahead and take a second. This is actually our way of making sure you're all with us in a way, in addition to getting some great information from you.
All right. So I should be asking what percentage of people have responded, right, to see if we're achieving some level of scale here.
Exactly, and see how fast I can do percentage on the fly. I would say it's looking like about 30% of our folks have responded. So if the rest of you are moved, please do go ahead and click. And none of the above is a fine answer. A lot of folks, while they've done Roma-based improvement, they may not have done it in a formalized way. That's important for us to know, too. It's okay to be exactly where you are. So as we move forward to closing the poll, it's looking like a few folks have used Six Sigma. Very few, none have used Fail Fast, Fail Forward. Plan, Do, Study, Act is coming in at about a little under half the respondents, and none of the above is slightly over half of the respondents. I'm going to go ahead and close that poll, so you'll have another 20 seconds or so to give us any answers you want, so that Susan can move on with the next slide when she's ready.
Okay. So if I heard that right, then about half have used Plan, Do, Study, Act, and about the other half were none of the above?
Generally, we don't have 100% scale response, but of the responses, that's about right. With a few outlying Six Sigma folks. Three agencies have done that.
Yeah. Okay, thanks. And I'm guessing, again, for the ones who said none of the above, you've probably used some continuous improvement. It just may have been a more informal approach. And we'll talk a little bit more about the Plan, Do, Study, Act one, because I think that's one that more of you have used, and it's a pretty common one out in the field. Okay. I'm going to briefly describe a few methodologies for doing continuous improvement. At their core, all of these are based upon asking the right questions at the right time and taking action and then repeating it, repeating the process. You'll probably note that there's some similarity here, too, as we talk about it, between continuous improvement and the prototyping approach. And in fact, prototypes might be an explicit part of a continuous improvement effort. Beyond the methodologies, most importantly, and I want to underscore this, continuous improvement requires that we create safe spaces for learning and adaptation. You know, we need to think about who's in the room, how learning is facilitated, who's facilitating it, what are the incentives or risks for sharing lessons and mistakes. You know, sometimes people will bring in outside facilitators for learning meetings, for the specialists. So for two reasons. One, so that the leadership can participate as a learner, but also to kind of equalize the room so that, you know, frontline staff have an equal and sometimes more important voice even than senior leadership when it comes to this kind of learning. So 5 reasons for continuous improvement, and I don't think any of these will surprise you. You know, it's about streamlining and improving services. It's about connecting the data to practice, ensuring that you're implementing change strategies that are effective and that you're discarding the ones that are ineffective. It's identifying and disseminating best practices and lessons learned, or better practices in some case. And, you know, as I was talking about before in terms of scale, it's about engaging stakeholders and experts, because you may need them in both as part of kind of an eventual scale-up process, but also to help you look at the data and do some sense-making with you. So how do you like this kind of complicated slide here? This is the plan, do, study, act cycle. And so let's take a look at this first approach. The plan, do, study, act cycle. Because CI is an iterative process, you can enter it in various quadrants or various squares here. So in this example, we've been operating a program to enroll parents in job advancement workshops. It's already been tested in a small-scale pilot. So we thought we knew what we were doing. But now when we looked at our results, only half as many parents were enrolling as they did in the pilot. We're not quite sure why. So like you start then in the study box, examining the characteristics of the enrollees, and then also who didn't enroll in the job advancement workshops. We might do some focus groups to learn more and test our assumptions about who we thought would be interested in enrolling in the job advancement workshops. And then based upon that study analysis, you move to the plan box, where we decide, given the information that we've just looked at and from our analysis of what the problem and challenge is, we've decided that we want to target parents who've been employed for 6 months. So we think that would be the group who would be most interested in workshops. Don't know if we're right or not, but given the information, that's the direction it's pointing us in. So then we move to the do box and carry out that plan. And then we act by making adjustments as needed and measuring outcomes. And then after a period of time, you know, it might be a month, it might be 2 months, it might be 3 months, you take a look at the outcomes. So, you know, where we thought we'd be getting 50%, but the first time around we only got 25%, are we closer to 50% now? And if we are we happy with that? And if we are, we might, you know, just move on to some other challenge. Or if we're still at around 25%, you know, we might say, we need to look at our assumptions another time and kind of go back into that study box again. But again, so all of this is really iterative. Okay, sorry, I was having a problem moving forward there. The before, and so another framework, the before and after action review was developed by the military, and they use this extensively. We've made sort of a rather straightforward example here to illustrate this one. So in this example, we've used the approach to examine a specific event. The event was about celebrating the parents who had graduated from a training program. Again, it's very straightforward usage of the before and after action review. So again, the event was really about celebration. What did we think would happen? So we thought 75% of the families would attend and bring a healthy side dish. So we, as part of this, were providing the main course and dessert. And one of the things that we hoped was that parents would have a chance to bond with each other. So what actually occurred? Well, instead of 75% of the families, 60% of the families attended, and they all brought side dishes. But most of them were not very healthy. So they all brought, but maybe not as healthy as we thought they'd be. So what worked and why? Well, for a first event like this, the turnout was pretty close to what we expected. We were actually, talking about it with our staff, pretty happy. And the families had a really good time, and the kids' activities worked out well, and the parents had a chance to kind of meet each other over food and informal discussion. So the bonding that we had hoped for, did happen. So what can be improved and how? So, well, maybe we would have gotten a little bit higher participation if the parents had been more involved in the planning. We had talked to a couple of them, but we could have had most of the planning, perhaps had them be in charge of it. There's something for us to think about in the future, but the idea would be to engage them a little bit more. We also could have engaged the healthcare instructor who's part of our program, maybe in teaching in one of the classes a little bit more about healthy foods prior to the dinner. And again, something that we can do next time and see how that plays out. Okay. So for those of you who do a lot of workforce development and job placement, you're probably familiar with the funnel. It basically takes the approach where we look, so do we have leaks in terms of how people are moving through our programs? Where are the participants dropping out? The continuous improvement activity then is to go deeper, sort of gathering more information, examining, are there benchmarks for, completion of these types of programs? What's a typical job placement rate like? What should we be aiming for? And then, but also kind of at each stage of this, articulating and challenging the assumptions that we have to get a better understanding of the problem. And this one really fits in pretty well within the plan, do, study, act cycle. So again, for this one, which is around workforce, first thing one does is there's the outreach, and people enroll in the program. Then you move towards completion or graduation, and then the last element would be job placement. And with that, I turn it over to Lil. I think, right?
That's just fine, but I'm going to actually pass the slide ball to Jeannie. But I am going to pause it here.
I pass it over to you, Jeannie.
That's all right. The beauty of the technology. In this instance, though, I do want to stop us. We do have a slide here for questions, and I've posted a chat to the group. Again, your chat window is on your right-hand side of your screen. If you don't see it, if you hover your mouse over the center bottom of your screen, you'll see a series of little circles pop up. There's one with a little talking balloon, which everybody knows from comic strips, if not from online memes. And that lets you open and close your chat. So that's how you access it if it's not showing up. And we'd like to know if you have any questions about continuous improvement, or really about anything so far in the webinar. Any questions about how to apply this in your agency? We'd like to know what's on your mind as we move forward into the presentation. Let's see, it looks like it's lighting up. How formal, let's see, I think this could be for either of you, but let's start with Susan. How formal is continuous quality improvement? Does it always have to be a framework, or can we just talk about it?
It's a good question. I've been working with a group of organizations who are doing kind of the bundling, workforce, income security, income supports, and financial capability. And after a few years of kind of just doing it, I would say they were in the pilot kind of stage of this, we actually introduced a more formal continuous improvement. And we asked them to choose a methodology. And we did this in part because we felt like they weren't fully, a few of them were. We had one organization that was almost in a continuous state of continuous improvement. What we found there was they sometimes didn't take a breath to actually and wait long enough to let something play out before changing it. And other organizations were a little less sophisticated, perhaps, in doing continuous improvement, and a structure helped them. So I guess the short answer is I don't think you have to use a formal methodology, but I think it does help, because it reminds you to ask the right questions. It reminds you to engage the stakeholders. It reminds you to set a time frame for doing it. And one thing Jeannie knows, I've developed almost a generic continuous improvement self-assessment, which kind of builds from different methodologies, but just focuses on the questions you need to ask. So I guess I would lean towards it's helpful to use some formal approach. It doesn't have to be really complex, though.
Yeah.
We have a great comment, if I can. Jeannie, did you want to add on to that?
Well, I was just going to say that I think I would agree with everything Susan said, and I would say from a community action perspective, you sort of think about the spaces where it makes sense to add continuous quality improvement. Like if you're doing joint case planning across community services and Head Start and workforce and Section 8, and maybe all your caseworkers are coming together to talk about families, to add a CQI process where you begin to not just talk about what's going on with individual families, but start looking at the data and what are the results and how you might be able to improve them overall. So there may be some natural places that you could add this. I think creating the space to actually have conversation in the agency about how you improve is really important in today's world.
Yeah. And just building upon that also is around the issue of creating a safe space. So if you have built in continuous improvement as just part of your agency or part of a collaborative, it's just part of the learning. It's not a blaming exercise, and here's a tool that everybody is engaged in some ways as equals, as learners.
I think that's very true. This is Lil. I have a comment more than a question from the chat window, and I think it's important. Nice webinar, first of all, so thank you both. Is looking forward to checking it out. But thinking of ROMA, Results-Oriented Management and Accountability, as a framework for continuous improvement, but this person's noting that they see they could use ways to examine the bits inside of the process. And I think she's actually really put her finger on it, which is that ROMA is in fact this big picture, it's community actions process, but how we actually get into the continuous improvement, how do we know where to ask the questions, how do we see where those pulse points are for connections is exactly what we're talking about.
Right, right. So I think, one of the things that I would want to make sure that we didn't end this call without saying is that, and I made a vague reference to it earlier, that Roma Next Generation was really about adding in continuous quality improvement and learning. And we just are trying to think now about how to formalize that more, create space, structures, frameworks. But all your Roma data is great data to use to improve, right? And it's sort of like, but where do you start? Where do you dig in at? So.
And, one of the reasons I showed the funnel for workforce, because in workforce is a really clear set of milestones along the way. And I believe that Roma very much uses sort of a milestone type of approach. So I think it's sort of whenever you're not reaching, wherever at critical points where you're not reaching those milestones is a entry point for continuous improvement. Again, in workforce, there's some pretty clear benchmarks. In other fields, maybe not quite as much, but.
Yeah. So, Lil, do we have any more questions, or perhaps we may need to move on to resources?
I think you've covered the others that have come in, so I think it's okay to move ahead to those resources.
All right. Thank you, ladies. So one of the things, if you dropped in with us on Wednesday before, you know that we always like to highlight some resources where you can go to learn more. And as I said in the beginning, in an hour and 15 minutes, we can't dive too deeply into any of these subjects, but we can give you a little taste, and then you can sort of go look to see where you may be able to expand your learning. And certainly when we're talking about prototyping or piloting or CQI, there's lots of places to go out there and learn more. So I'm just going to highlight a few of those for you. And some of it is through the partnership, and other resources are with partners and other entities out there. So first off, on continuous quality improvement, we bumped into an absolutely fabulous toolkit that the Office of Planning and Research and Evaluation at ACF has put together, and you'll see the link here, and you'll have this slide deck posted up and you can go into it. But even if you just Google this continuous quality improvement and maternal, infant, and early childhood, you can probably find it easy. Now, this was designed by ACF for maternal, infant, and early childhood home visiting programs, but the concepts are very transferable. And one of the reasons that I love this toolkit is that, and I can demonstrate this on the next slide, they actually post and open source the slides. So I just pulled this slide right from the kit. And you can have PowerPoint slides, there are handouts, there are worksheets. It's 9 modules on CQI. So I really highly recommend it. And again, you can see there understanding PDSA cycles. So it covers a lot of what we talked about. There's the greatest tool in here in Module 9 about root cause analysis, the fishbone, this great fishbone worksheet. So, and I love what they have about driver diagrams. This key driver concept is really useful for community action. So those of you that are really into this could just geek out with this whole toolkit. It's really good. So I encourage you to look at it. Another thing that we didn't talk about too much today, but we've done other webinars, and we should have posted a webinar that we did last year on here on journey mapping, which is part of the human-centered design process. And when you're prototyping and piloting journey mapping, looking at your customer's journey is often a common exercise. And so human-centered design, which really gets at a lot of prototyping issues and journey mapping, and really idea generation is really useful when you're in the space and you're thinking about prototyping. And so there's, again, at ACF, there's a document that they put together on design thinking for the Office of Family Assistance, and they have 3 grantees that use design thinking, and they give you those case studies. So that's very helpful. And then IDEO is a website. It's an organization that does a lot. They're sort of like a leading thinker in design thinking. And they've got a wealth of resources. I just picked one that was on prototyping that I thought was very useful to community action colleagues. And then they also have IDEO University, or IDEOU, which has pretty reasonable training programs, online training. And some of those are free, some of them are a cost, but even the ones that are at cost are not crazy. So some of you might want to build that into your professional development plan for the year, and to complete some of those online courses that will really help you to learn more about prototyping, design thinking, and those kinds of issues. And then, of course, I know we had almost 80 people on the webinar at different times today, and I know in that group of 80 there are probably a lot of Roma trainers. We have a lot of resources out there for folks who are Roma trainers, or for folks who are in agencies that want to work on theory of change. You can see those on the Partnerships website, and also on the Community Action Academy, which I'm going to talk about in a moment, that maybe some of you have used, or maybe new to some of you. But we have electronic courses on theory of change on the Community Action Academy that may be useful to you. So if you have not gone, so there's this Moodle platform, which is sort of the software that the Community Action Academy is built on. And if you're in a learning community, you've already signed up for a Community Action Academy account. But anybody in the network, whether you're in a learning community or not, is welcome to join the Community Action Academy. And there are on-demand activities and videos and these e-courses, electronic courses. And there is one on theory of change. And it curates certain videos and training materials for you that you can kind of work through, and you can self-enroll yourself in that e-course. There is also an e-course that's just been created on family-centered coaching. So if that's an area that you're interested in, you can do that. So you're welcome to explore and use the Community Action Academy, and you'll have the link here in the website, and it's on the partnership website on how to access that Community Action Academy. Once you get in, it looks a little bit like this. So there are certain courses. If you're in a learning community, you are enrolled in certain courses, you can go to these topical courses tab, and you'll see the family-centered coaching, advancing to Gen in a role context, and that's also where the theory of change course is at. And also, just so folks know, there's an app you can download on your Android or your Apple iPhone for the Community Action Academy. And the reason that I think this is really important and I want to highlight it is that if it's on your iPhone, if you're in a car or you're on a bus or you're jogging to get your exercise, you can listen to some of these videos just like they were a podcast. And sometimes it's hard to find time when you're at your desk to watch some of these videos, but you can listen to them anytime on your Community Action Academy app. So think about that, and that may be helpful to you. And then finally, you're here with us on Wednesday, and the partnership always has a webinar on Wednesday, and we're just highlighting 2 that are coming up here. One is on the CCAP certification, the exam, So if you're in the class to pursue CCAP, or that's something you're interested, please join that webinar. And then on the 17th, we'll be looking at analyzing and addressing community level work, which I know is something that a lot of agencies are thinking deeply about, is how do we change systems and policies and practices to make conditions better in local communities. And so that'll be on April 17th. We wanted, Lil and I were both talking earlier before we started about the Immigration Summit. So all of Lil's colleagues are down in El Paso at the Immigration Summit, the Community Action Partnership Immigration Summit. And that goes to today, tomorrow, and I believe on Friday morning. And there's a live stream for that, so you can go on the partnership's website and access the live stream. I was listening this morning to a couple of panels that were just phenomenal and raising all kinds of issues. And we all know that this isn't just an issue in El Paso. This is an issue all over the country. And there was deep discussion about changing the narrative around many of these issues, the legal issues that our customers face, which programs are immigrants eligible to receive, and just a number of really important conversations. So if you have time this afternoon or tomorrow, please drop into the live stream. And then that will also probably be posted relatively soon on the partnership's website. So if you can't do that today, you can go back and listen in later. Also, we want to make sure that everybody puts on their calendar the Community Action Partnership's annual convention, which is in Chicago, and that will be in August. So please plan to join your peers and your colleagues in community action there. And here are the contact emails for all of the partnership staff and myself included. If you have an issue that you want to talk more about related to anything today, we're happy to talk via email and help you in your approach. This will be posted, so if you want to share it with colleagues who weren't able to join us today, we hope that you do that. And then I would just say any last comments, Lil or Susan, and thank both of you for being here and everybody for joining us. And is there anything you would like to add before we go?
Susan, any final words of wisdom for our team?
I just wanted to thank you for including me in the webinar. And, you know, through Jeannie, you know, I'm available if anybody has any specific questions about any of the specific topics.
Wonderful. Thank you so much. And thank you, Jeannie, as always, for the terribly valuable partnership. Everybody, I think my only word of wisdom is what we said earlier. It's okay to start exactly where you are and be picking up these pieces. The continuous improvement means obviously taking it from where you are today, not from some future point of, oh, we'll start there. So just bear it in mind as you look through this. As Jeannie mentioned, this webinar recording and the slides will be posted in the next few days on the partnership's website. We look forward to questions coming in via email and to seeing you at future webinars. On behalf of the Community Action Partnership, take care. Have a great rest of your week, helping people and changing lives. Bye-bye.